being in practice and also, when I was in my training, a lot of chemotherapies, we used to admit the patient in the hospital, still not able to control the side effects. Then came the revolution of the nausea management that patients still fear when you talk to them about chemotherapy side effects. They will remember somebody in their family was so sick with the chemo, that's the first thing they talk about is, I don't want to be sick, I don't want to. And that is not anymore an issue with most of the patients because of the revolution in the management of the nausea drugs. And the excitement is what we have seen in the last 5 years. If you look at that excitement, what has gone, you can't imagine what would be the one that will be coming in the next 10 years. Understanding the biology of the cancer, understanding why the cancer happens. And if we can understand why the cancer happens, then we have medications that we can block the different paths that are causing the cancer. So that's how the excitement have changed was as you are learning more about the biology of the cancer. And the research has gone so fast in the last several years. Some of the cancers that we do not have any options, or the options were so bad, it could not help them a lot until 5-6 years ago. So those cancers, particularly melanoma, kidney cancers, these two has 1 or 2 options, none at that time. Now each one of them has 7 to 8 options. And look at the lung. The lung is the leading cause of cancer death in the country. And for about 10-15 years, the drugs were the same. We are using one drug or the other drug. Doesn't work, we go to the second one. But no significant advancement was made until the first immunotherapy was approved for lung cancer 2015. So in the last 2 years, there are so many newer immunotherapy drugs came in. Now you have choices. So in the past, we used to think, okay, we have these chemotherapy drugs, but we have significant toxicity. But now we have these new drugs, new options, lesser toxicity, and some of these things patient able to take them at home. It doesn't have to come to the office for administration of chemotherapy. So you have better options, lesser side effects, better quality and quantity of life for the patient.